I'm Dr. Jett, and I've had a passion for public health for over 30 years. Now I'm in a position to affect change, and these are the critical conversations about health and our community, with people who can help me make those changes. Good morning. Welcome to CEO Live Talks. I'm your host, Dr. Jett, and today I'm having a very intellectual conversation about health with Mr. Steve Tarver. Welcome to the set.
It's great to be here. Thank you for this opportunity. It's very special.
Well, I don't know if it's special yet, depending on what I say. I usually start the show, talking about your background and give us a sense of where you were born. I know it was somewhere hot.
Yeah.
In your early years and what shaped your life.
Well, thank you again, Dr. Jett, for having me. I was born and raised in Jacksonville, Florida. So a lot of people think that's part of South Georgia, but it's really still part of Florida.
It is.
And I got involved with the YMCA when I was 5 or 6 years old. And my parents were very, very supportive of that, particularly during my teenage years. My dad would pick me up and drive me across town to the downtown YMCA there in Jacksonville. And I was kind of raised there in terms of leaders. There's a national program of the YMCA called Leaders Club. I'm a Leaders Club kid who has stuck around the Y for 60 years now. Okay. And it's been a blessing to my life. But we had a moderately stable home life, so I was fortunate in that regard. Mm-hmm. And so between the church, the YMCA, and my family, I had a reasonably stable upbringing. Okay. And did okay in school, and wasn't necessarily. I didn't have a lot of spare time on my hands, and when I look back on that, that was a big blessing. Mm-hmm. And we've made a commitment to our kids that they have to keep things going in their lives outside of just school or just church. Right. But in any case, so I got a lot of training. I got a lot of experience. My first job at the YMCA was as lifeguard and swim instructor back when you could do that when you were 14 years old. You could. And so that's how I started. And I've taught thousands of children to swim. Mm-hmm. I have given hundreds of fitness evaluations, and I've given lots of opportunities to work. I've been a day camp counselor, an overnight camp counselor, a camp director, a janitor, a front desk person, a towel washer, and all of those things. And all of that it gave me a place to belong. Right. And it gave me positive influences, and it gave me a lot of training both in tactical areas of the YMCA, like swimming, gymnastics, camping, after school care, etc. But also was my introduction to the concept of leadership, which I believe is a lifelong journey. So that's the journey I continue on today. Okay. So tell me a little bit about Jacksonville, because, I have a house in Sanford, and Orlando is different in Jacksonville. Well, and when I grew up in Jacksonville, it was mainly an urban area with an urban downtown. Mm-hmm. I lived in the suburbs, but we were in a very, very middle-class suburb. Okay. And everything was downtown and away. Mm-hmm. And a trip to the beach, to Jacksonville Beach, was a day trip. Wow. And now it's a completely fully developed metropolitan area, all the way to the Atlantic, up to the Georgia line, down about halfway to Orlando. Okay. And so it's changed a lot since I was there. Okay. And I've lived away, and I've worked at various YMCAs, mostly in the southeastern United States, since then. And my wife and I have 2 grown children that live in the Tampa Bay area. So we kind of go between. My dad was actually from Fern Creek, Kentucky. Oh, wow. So I knew the Kentucky landscape. My children were born in Owensboro, Kentucky when I worked at the Y there. So when I came to Louisville in the year 2000, it wasn't a foreign landscape to me. And I came here to get a more urban YMCA experience.
Okay.
And so that all's been a blessing to me, and the community's embraced our organization, and we just try to, through collaboration, do good work like the collaboration we have.
Right. Correct. So did you have any brothers and sisters?
I have one younger sister that actually has retired in the area near Gainesville, where my parents retired.
Over in Ocala.
A little lake area. It's Keystone Heights near Stark.
Mm-hmm.
And so that's where we still hang out occasionally when we're down there.
Okay.
And visit my sister.
So I could tell the family loves Florida.
Yeah. We're and my kid we moved to Florida when my children were in elementary school. So that's where they grew up. And
So
my daughter never
know.
left the Tampa Clearwater area. My son left and came back. So that they're both down there now.
So you're a Seminole.
I am. Right. I'm feeling good about it right now.
Feeling good about it today.
The last few years have not been so great.
It's not been
But
great.
yeah, we're feeling pretty good right this minute. So we try to celebrate while we can.
Right. So where did you get your education in?
I was a psychology major.
Okay.
And I was working with the YMCA. My first full-time job was at the YMCA in Tallahassee.
Mm-hmm.
And so I did that all through school and continued to do that beyond. And I went from Tallahassee to up to Fort Thomas, Kentucky.
Okay.
Back in the late 70s.
Fort Thomas, Kentucky. Okay. All right.
So
I mean, it seems like, and I can relate, because I had my kids in the wild. They played baseball, might have been t-ball then, and basketball, because I remember some of the basketball sports, swimming. But what drove you to a life of giving? Because, to work at the YMCA, you're constantly raising funds, you're constantly trying to improve the community overall, provide a healthy environment, physical activity, but you also have to deal with some of the social issues that impact kids to come, especially into an urban one. Mm-hmm. So, what led that journey?
Well, like I said, I found a place to belong with mentors that are legendary in our YMCA movement, nationally and internationally. So that was a big blessing. And I just love the work. And of course, you say it's a giving environment, but what I tell people, I've been doing this for over 50 years on a full-time basis. And I find that the more I give, the more I get back in return.
That's true.
So in terms of a sense of belonging, which I believe a sense of belonging is a basic human need.
Right.
I got that not just with my family, but at the YMCA as well. Mm-hmm. And so I call myself a debtor to the YMCA because I've gotten so much back, and, mm-hmm. and I spent a lot of time talking to people about gratitude.
Right.
And if we've done something in the community that's better, our mission is to help people grow in spirit, mind, and body based around youth development, healthy living, and social responsibility. Mm-hmm. Those are broad areas.
Very broad.
And that gives us the privilege of working on a local level. A lot of people at the Y say all YMCA work is local, is on a local work.
Right.
And I believe that to a great extent. Social media has brought us closer together, of course.
Yes, it has.
But still, Louisville has opportunities and challenges that are different than anywhere else I've ever lived. And so it's kind of fun to be able to talk to people like yourself and other people that can give us feedback on the community needs. And then we craft expertise that we can bring to some of those things mm-hmm. to meet those needs. So we don't talk about what the Y needs. We talk about what the community needs and how the Y can fit in.
Right.
And again, collaboration is the new word of the day. Mm-hmm. There's not enough resources and there's not enough ways to impact the community on a scalable level unless you collaborate with other people, again, like we're doing together.
Hi, my name is Farron Jackson. This is Shakoya Gurton, and we're both medical assistants here at DuValle Women's Health. We specialize in pregnant women, mammograms, ultrasound, and any vaginal complaint. So we offer free pregnancy tests. We offer glucose testing for our patients who are 27 weeks pregnant, We offer mammograms if they need one, if they find any lumps in their breast, and we also offer ultrasound if there's any abdominal pain or a pregnant patient. It's important for our women to keep up with their bodies, because if they was to have a lump in their breast and they don't perform monthly, everyday breast check, it could be a lump there that may need a mammogram, and we could catch it just in case it's cancerous. You can contact us at pdchc.org, or you can call 502-774-4401, extension 1142.
Hello, my name is Sierra Clark, and I'm the Chronic Disease Manager at DuValle Community Health Center. Ever since I started at DuValle over 9 years ago, I have been committed to helping patients live healthier lifestyles. I am currently serving patients in the Chronic Care Management Program, or CCM program. My team and I help patients manage their chronic conditions such as obesity, high blood pressure, high cholesterol, and diabetes. In this CCM program, you will receive several benefits to help you manage your health. We offer monthly telephone calls to check in with your progress and to assist you with any concerns, assistance with scheduling your healthcare appointments, and assistance with filling your prescriptions in a timely and convenient manner. We also offer many resources to help you with the barriers you may face with eating healthy, being physically active, or monitoring your conditions at home. For more information, visit us online at pdchc.org or visit one of our health centers.
So you've been at the Y 50 years. What has changed? I mean, because I can imagine the Y was totally different when you started.
Well, obviously, most people know that the Y was started for young men. It started in London, England, actually, during the Industrial Revolution. And the Y in Louisville was the 10th YMCA start in the country. So the Y here in Louisville has been around for 170 years.
It's a long time.
Another blessing and opportunity and challenge that we have. But when you talk about what's changed, you talk about the nature of the workforce, two-parent working families, led the Y in the 70s and 80s to the child care business. That was not a core program of the Y. Fitness was not even a core program of the Y until about 100 years ago. And where the Y was dealing with young men in urban areas that couldn't find their way out of the bars and the pubs, and lack of prayer, lack of faith, lack of hope, all tied into the founding of the YMCA in those early years in the late 1800s and early 1900s. And so we did get involved in the health movement, particularly around fitness, which is a transition that we're in right now, very dramatically, looking at health differently. But and then, you know, around youth development, you know, I still believe that every child should learn to swim, not just for safety reasons, but mostly for confidence and self-esteem, which is dramatic, and I've seen it, and I can describe it in the sparkling eyes of a child that overcomes a fear of water. So that, and of course, in the last 10 to 15 years, we've had a higher recognition and a higher community and national conversation about equity, health equity in particular. That was the transformational piece for me back in 2007 with a mutual friend of ours, Dr. Adewale Troutman, who coached me on the concept of equity and the choices people make are the choices people have, and everybody doesn't enjoy the same choices to good health. And when I talk about health, I'm talking about the social determinants of health, not fitness and treadmills and weights like a lot of people come to image.
That's what they first think about when they think about health.
So we're on a journey to change the definition of health around relationships and education and violence reduction and transportation and food security. I'm embarrassed to say I didn't know that the words food security even went together in one sentence.
Yeah, normally they probably wouldn't.
Well, good point. Yeah.
Normally wouldn't.
But you know, that's a big issue these days.
It's a big issue.
And we're not going to have health unless we manage social determinants in a way that contributes to people's lives and health, as opposed to detract from people's lives and health.
Right.
And that's going to take the entire community to come together for that.
It's a monumental task, you know, and I'm thankful that Dr. Trotman came to Louisville and began to teach that ideology. And I picked it up from NATO as well when I became president, and took it to Sanford, Florida. But I tell you the most disheartening aspect that I see, because, and I had this conversation with somebody that was over the rec department in Seminole County, Florida. I said, we tell people to go exercise, and yet our parks are not safe and they are dilapidated. And so, you know, Louisville is fortunate enough to have the widespread expand. I still think we need one by Park DuValle. But I know it has to be disheartening for you, because over your time at the Y, it seems like the livable wage and the conditions of Louisville hasn't shifted much, right?
Well, you know, I'd like to think that there's opportunities that are starting to be embraced in that regard.
Right.
I do find Louisville to be have a very collaborative sense about it. You know, we're doing things, again, since Dr. Troutman's influence, we're doing things that we never thought were part of a YMCA.
Right.
You know, we did corner store conversions. We did.
I remember.
We did parks improvement over at Victory Park, not too far from where we're sitting.
Right.
And so those things need to be perpetuated, but we're going to have to, number one, change the definition of health.
Right.
You know, health, according to the World Health Organization, is actually a harmonious balance of spirit, mind, and body. Those three words are also in the Y's mission, coincidentally.
Right.
But what I love about the definition, it goes on to say, beyond being unsick.
Right.
And that's why I'm involved in a lot of conversations in communities now around developing a continuum of health that goes from treatment to prevention to thriving.
Right.
And thriving should be the goal. And that's where people do not equitably have opportunities to make the decisions that will allow them to not just be unsick, but to be thriving.
To be thriving, to be healthy.
Right.
I always say health is the end point.
Yeah.
Right? It's the environment you live in and how that shapes your health.
Right.
I mean, you have a very unique lens, because a lot of people, especially, you know, in the community overall, really don't understand the magnitude of your lens in terms of health equity. When did the light bulb go off and you begin to look at the YMCA and how it contributes to the overall community? Well,
it really went off sitting in my office on an April afternoon in 2007 with Dr. Troutman.
Okay.
He's helping me write a grant, a national grant that we got involved in called Pioneering Healthy Communities. And because, first of all, even within the YMCA, the 90s for the YMCAs all across the country were wonderfully successful, except the health of our communities continued to decline.
Okay.
Dr. Troutman said, Steve, you know what I would do if I could do one thing to change the health of the community? And I'm thinking, I'm a fitness guy from way back in the Y. I'm thinking more weights, more group exercise classes, maybe community walks. I need to get my skinfold calipers and start pinching people again and measuring their body fat. And he said, I would improve the high school graduation rate. That was a giant whack upside the head for me. Led us to doing programs with a couple of school systems where we had over 1,000 children during the summer in summer learning loss prevention, because children from environments with less resources regress during the summer. And we had the opportunity to do that. That's still a big part of our program delivery.
Okay.
But that was transformational beyond what I can even describe.
Right.
And so we started looking, then we went into the social determinants of health. And we were looking at access, we were looking at transportation, food security, education, violence reduction, chronic disease prevention and data,
Right.
and so forth. And there's clearly challenges
It's a lot of challenges.
in areas that are geographic. And,
Right.
and lastly, I would say, which you know better than I do, is that your life expectancy is as much related to your zip code as it is to your DNA code.
Correct.
And that was revelational for me.
Hi, I'm Destiny. I'm the Community Health Workers Manager here at Park DuValle Community Health Center. This is my team of community health workers.
Community health workers close care gaps, reduce barriers to care, and address health disparities in our community.
Community healthcare workers act as a bridge between the patient and the provider to stay engaged in the healthcare plan.
CHW strives to work as committed care team members for PDCHC, for current patients, and to provide access to those who need a new medical home. For more information, please visit pdchc.org or visit one of our centers. Thank you.
If you or someone you love is considering therapy, contact the professionals at Park DuValle Community Health Centers today.
Hello, my name is Sierra Clark, and I'm the Chronic Disease Manager at Park DuValle Community Health Center. Ever since I started at Park DuValle over 9 years ago, I have been committed to helping patients live healthier lifestyles. I am currently serving patients in the Chronic Care Management Program, or CCM program. My team and I help patients manage their chronic conditions such as obesity, high blood pressure, high cholesterol, and diabetes. In this CCM program, you will receive several benefits to help you manage your health. We offer monthly telephone calls to check in with your progress and to assist you with any concerns, assistance with scheduling your healthcare appointments, and assistance with filling your prescriptions in a timely and convenient manner. We also offer many resources to help you with the barriers you may face with eating healthy, being physically active, or monitoring your conditions at home. For more information, visit us online at pdchc.org or visit one of our health centers.
I will say I use the Y, especially 17th Street. My kids go to camp at the Y. Wife uses it. And also I use the one in Jeffersonville. So the Y is beautiful. You have the computer lab in there as well. I notice kids learning IT.
At 18th, yeah.
On 18th. And you also have a school that's being built. Talk about the school, because that's a unique concept. A school and the YMCA together.
Well, there's only a few of them in the country. We're proud of that. We have two of them here in Louisville.
Okay.
We have a suburban version and an urban version that just opened. I was there the first day of school, and I got to see all the people coming in and wandering through this magnificent new school that's part of the YMCA building. And but that started with Dr. Troutman's answer to the question I mentioned earlier about improving the high school graduation rate. That was not a place where the Y had ever been for the first 150 years. So we went to the then school superintendent and said, you can throw us out, but a board member and I went in and said, what if we built a YMCA and a school together? He said, build it tomorrow. Well, 10 years after that, we finally got it done in Norton Commons. And then, so we worked on the West Louisville project. That was on our radar screen from day one. And that was an urban version of what we did in Norton Commons. And it just opened a few weeks ago. And, so far so good. We've worked with JCPS to get the transportation, help get the transportation, make sure the children are safe before and after school. And so those are the things the kind of collaborations we want to continue. Again, bringing the health, the educational, the treatment into a continuum, not separate silos,
Right.
where people can work together for better health outcomes.
Well, I would tell you that's first of all, great vision, hell of a legacy. I mean, you could say staff around you, but it takes somebody to have that vision to drive it. You got to have vision, otherwise it just doesn't happen. You know, I know you're retiring soon, so what's next?
Well,
Because I don't see you going into the sunset and hanging out in Tampa or Jacksonville.
That will not happen. I've had a few people reach out to me about doing some project work and things like that. I'm hoping that I'll have a chance to have some time here in Louisville with the new leader and talk about, I want to pitch the things that I think need to be perpetuated. And I want to also, you know, plant a seed for things that I've not done as well as maybe I should have, that need to be done differently with the new leadership. So I'm excited about all that. But I will reconnect with my children. I've not lived close to my children in 23 years.
That's a long time.
And so I'm going to reconnect with my children. I say I only bother them now 5 or 6 times a year. I want to bother them at least once a week. After that.
That would be great.
You know, this transformational experience that I've had with Dr. Troutman, with you and others, has been transformational. And I like to think it's part of my DNA. And I'm going to continue to be an advocate for that. I do have I have some occasional speaking opportunities to go around and talk about health equity. Still a relatively new concept. We were blessed to get it 10 years before it became a national conversation here in Louisville with you and Dr. Troutman. And so I'm going to be very loud and active in some of those arenas. And there's some program development things that I'd love to have time to do, and I hope to get involved in those, maybe with the YMCA, maybe outside of the YMCA, but things about, again, youth development, healthy living, and social responsibility.
Well, I would just tell you this up front, and I'm sure the board knows this. You have set a hell of a path. Louisville will still need you.
You're kind to say.
and I will still need you to be around. And then I'm going to pinch whoever the new leader is to make sure some things don't fall off. And that we can build a stronger relationship. And we need more people to be like you as advocates for health. I want to thank you for coming to the show
You're
today.
very gracious.
Thank you for tuning in. Stay tuned for next week's edition. I'm your host, Dr. Swanee Jett. Thank you.